My lecture today was really focused on the regulation of midwifery and reform of the maternity services, with a view to developing a system of care that included out-of-hospital birth and in-hospital birth, but making the quality of care in the hospital better. And I talked about the need to have a strong midwifery profession and how midwifery is regulated in much of the world, particularly in the United Kingdom. I also talked about the European directives for midwives that say that a midwife should be entitled to look after women before pregnancy, during labour and birth, and after birth on their own responsibility, and be able to refer to a doctor when a problem arises. And of course, they also have a role in providing family planning advice and education. But I think one of the issues in Hungary is how can midwives meet those directives, because there is a problem with them meeting them. Problems that we have in the maternity services in much of the industrialized world, the cesarean section rate is too high. Once it gets above 15%, you don't see any parallel decrease in mortality rates and the low level of normal birth. So I talked about the importance of midwives being able to support women in having a normal birth and some of the evidence around that. But much of my lecture was about the overriding principles and values of good maternity care. And that's recognizing not just that physical safety is important, but that we're there at a time in which the baby is born to the mother. The birth of the baby is the birth of the mother. And we need to pay attention to support and recognition of the importance of the attachment between the mother and baby and the family. That's life-saving. The human baby actually depends on the love of the person looking after him or her. And that's as important a safety issue as anything else. And at the end of my lecture, I invited everybody there to think about the real purpose of our work, because I think our paradigm, our worldview is changing so that we can take into account these social and psychological and emotional aspects. And importantly, I said that the public should be involved in the development of maternity services and in the evaluation of maternity services, and that everybody needed to move together to reform maternity services in Hungary. My feeling since I've been here is that Hungary has a huge opportunity to be innovative, to learn from the mistakes of the rest of the world, but what has worked, but what works best for Hungary, because it's a very particular country.